with children, we are their caregivers. We have to be able to do this. And also understand that it's not a cure. It's a different set. And I think that brings up another point, that I spent years learning how to care for two of my children who had cardiomyopathy. I knew what to look at for, even though I questioned myself, I knew what to look at for warning signs. I became an expert, at least, on things to look for, how to care for them. Then you go into the transplant world and you cross that bridge, and all those expert skills kind of get taken away because you're in a brand new territory with new things to look for, new risk factors, new concerns, and it becomes really a whole new learning curve. Where again, a lot of communication and teamwork is very necessary.
It's a really complicated time, especially for heart moms, because they have, and again, I'm generalizing, but many of the parents that I've seen have spent years learning their child and learning their heart disease and are expert in their child's heart disease. And then you take out their diseased heart and you give them a normal heart. With immunosuppression and medications that come along with that. But that expertise around their child it takes about 6 or 7 months for most parents to, again, become the expert in their child. And we are constantly saying, no, you are still the expert in your child. We need you to tell us when you are wondering whether something is not right, because you actually still are the expert. I think for the transplant docs, being reassuring enough to say, I know this is your first time doing this. I've done this 316 times before. And so we're going to team up to help you do this. But it's very common across the experience to have this new heart. For the teenagers as well as the parents, I think the teenagers, that first 6 or 7 months is very unsettling. They don't feel like themselves. They don't feel well. And this heart that made them special, their whole life is gone. And so there's this grieving part of your story, especially for the families with congenital heart disease or disease since you've been born. And I consider them sort of congenital because you knew before they were born. This sort of identity of their child and their parenting is changed, and that takes time to get your head around. And it's a really special time, and I think it's why transplant docs and their families are so incredibly tight, and why people love to go into this field, because it's the time waiting and this critically ill and is the heart going to come in time and all of those things, but it's really those first few months where actually the experience of the doctor and the experience of the parent have to work together to figure out this whole new situation.
Yeah, I felt like I went from a somewhat confident mom and provider to a really needy mom. Just really, watching for what are the warning signs now, and exactly what you said. What things should I be worried about? What should I not be worried about? What are red flags? And just relearning your child. And I think especially as a mother, as a nurturer, as a caregiver, our goal is to take care of our children. And when things change, good or bad, this is something good that happened, but still relearning how to, know the warning signs and know what to look for, and trusting our instinct to know that also going forward. So it's another place where I think a lot of teamwork and communication is very important.